I killed 3 soldiers to save 17 children, and the Army destroyed me for it. Dr. Rachel Kensington stood in the parking lot of Walter Reed National Military Medical Center, staring at the building that represented everything she'd lost. 18 months ago, she'd walked out of a military courtroom with her career in ruins, her reputation shattered, and her identity stripped away. Now she was back, not as a decorated lieutenant colonel, but as a temporary contractor with a redacted resume and a 2-week probationary period. The November wind cut through her jacket as she approached the entrance. Her credentials hung from a lanyard marked Temp in bold red letters, a scarlet letter for the modern age. Inside, the familiar smell of antiseptic and floor wax triggered memories she'd tried to bury. Operating rooms in Kandahar, the weight of a scalpel in her hand, the sound of incoming mortar fire while she sutured arteries. If you want to hear more stories like this, subscribe to the channel and tell me, where are you listening to this story from? Rachel checked in at security, enduring the scanning process that felt more invasive than necessary. The guard studied her temporary badge with obvious skepticism before waving her through. She knew what he was thinking. Contractors were usually retired surgeons looking for easy money or burnouts who couldn't handle the pressure of permanent positions. She was neither, but explaining that would require revealing truths she wasn't ready to share. The administrative office was on the 2nd floor. Rachel took the stairs, her legs remembering the muscle memory of hospital corridors even after 18 months away. On the landing, she passed a bulletin board covered with commendations and photographs. Smiling doctors receiving awards, surgical teams celebrating successful outcomes, military personnel being honored for service. Her face appeared in none of them, erased as thoroughly as if she'd never existed. Dr. Marcus Brennan's office door was open. He sat behind his desk reviewing charts, his silver hair perfectly combed, his white coat immaculate. Rachel recognized him from medical conferences years ago, before her fall. He'd been chief of trauma surgery at Walter Reed for a decade, a man who valued protocol and precision above all else. She knocked on the doorframe. Brennan looked up, his expression neutral. "Dr. Kensington, you're early. Habit from military service," Rachel said, stepping inside. "About that." Brennan closed the chart and folded his hands. "Your resume has some gaps. 18 months is a long time to be out of practice." Rachel kept her voice steady. "I've kept my skills current through locum work and simulation training. Simulation isn't the same as live patients." Brennan pulled out a folder. "Your credentials are impeccable up to 24 months ago. Then nothing. No references from your last position, no explanation for your departure from military service. Just a discharge notation marked, administrative separation. Is that going to be a problem?" Rachel asked. Brennan studied her for a long moment. "That depends on you. Walter Reed serves active duty military personnel, veterans, and their families. We maintain the highest standards of care. I can't have someone on my staff who's going to crack under pressure or make reckless decisions." Rachel felt her jaw tighten but kept her expression calm. "I understand. Your assignment for the next 2 weeks is low acuity cases. Routine follow-ups, minor procedures, discharge planning. Dr. Park will supervise you." Brennan stood, signaling the meeting was over. "If you perform satisfactorily, we'll discuss extending your contract." Questions? Rachel had 1,000 questions, but none she could ask. "No, sir." As she turned to leave, Brennan added, "One more thing. Walter Reed has a reputation to protect. Whatever happened in your past, leave it there. We don't need drama. We need competent physicians who follow protocol. Clear?" "Crystal," Rachel said. She found Dr. Lena Park in the residence lounge, reviewing patient files on a tablet. Park was younger than Rachel expected, early 30s with sharp eyes and an air of perpetual skepticism. She looked up as Rachel approached. "You're the new contractor," Park said. It wasn't a question. "Rachel Kensington." "I know." Park handed her a tablet. "Here's your patient list. 12 post-op follow-ups, 3 wound checks, 2 discharge consultations. Nothing complicated. Try not to screw it up." Rachel scanned the list. Basic cases. The kind any third-year resident could handle. She swallowed her pride. Understood. They worked in silence for the next 4 hours. Rachel moved through her assignments with mechanical efficiency, checking surgical wounds, updating medication lists, answering family questions with practiced compassion. It was mind-numbing work, but she performed it flawlessly. Every patient received her complete attention. Every note was thorough and precise. She would give Brennan no reason to question her competence. At 2:47 p.m., the hospital's overhead speakers crackled to life. Trauma alert. Incoming medevac. ETA 3 minutes. Multiple casualties from IED blast. All senior surgical staff to Trauma Bay 1. Rachel's head snapped up. Around her, the hospital transformed. Residents and nurses moved with practiced urgency. Overhead lights seemed brighter, sounds sharper. The controlled chaos of emergency medicine. A world she'd lived in for 6 years in combat zones. She followed the flow of personnel toward the trauma bay, knowing she had no authorization to be there, but unable to resist. Through the windows, she watched the surgical team assemble. Brennan at the center, senior surgeons flanking him, residents positioned at the periphery. They moved like a well-rehearsed orchestra, each person knowing their role. The medevac helicopter's rotors thundered overhead. Minutes later, the doors burst open. Paramedics pushed gurneys inside, their flight suits marked with dust and blood. The first gurney carried an older man, his uniform bearing the stars of a 4-star general. His face was pale, an oxygen mask covering his nose and mouth, multiple IV lines running into his arms. "General Victor Aldridge," a paramedic shouted. "IED blast. Afghanistan theater. Multiple fragment wounds. Suspected internal injuries. Vitals have been unstable for the past hour. BP 90/50. Heart rate 130. Rachel pressed closer to the window. Something about the general's breathing pattern caught her attention. Rapid, shallow, with visible accessory muscle use. She'd seen that presentation before, in soldiers with blast lung injuries complicated by diaphragmatic rupture. In the trauma bay, Brennan began his assessment, calling out orders with calm authority, but Rachel saw what he was missing. The subtle asymmetry in the general's chest rise, the way his abdomen moved paradoxically with each breath, the faint distension in his jugular veins despite the hypotension. Her fingers tightened on the window frame. They were treating this as straightforward hemorrhagic shock from fragment wounds. They were wrong, and if they continued on this path, General Victor Aldridge would be dead within the hour. Rachel watched through the trauma bay window as Brennan worked methodically through his assessment. He was competent, thorough, everything a trauma surgeon should be. But competence wasn't enough when the diagnosis was wrong. BP dropping, a nurse called out. 70/40. Increase IV fluids, Brennan ordered. Get me 2 units of O-negative stat. Portable X-ray, chest and abdomen. Rachel's instincts screamed. Fluid resuscitation wouldn't fix this. The general's problem wasn't volume loss alone. His diaphragm was ruptured. Abdominal contents were migrating into his chest cavity, and his lung was compressed by both the herniated organs and accumulated blood. Every breath was a battle his body was losing. Dr. Park appeared beside her. "You're not authorized to be here." "I know," Rachel said, not taking her eyes off the general. "But they're missing something." Park followed her gaze. "Dr. Brennan is the best trauma surgeon on the East Coast. He's treating symptoms, not pathology." Rachel pointed at the monitor. "Look at the breathing pattern. That's not simple pneumothorax. The chest rise is asymmetrical, and his hemodiaphragm is paralyzed on the left side." Park studied the general more carefully. "How can you tell from here?" "Experience." Rachel turned to face her. "He needs a CT scan immediately, and they need to be looking for diaphragmatic rupture. If I'm right, standard treatment protocols will kill him." "Then tell Dr. Brennan." Rachel let out a bitter laugh. "The contractor with the questionable resume? He'd throw me out before I finished the first sentence." Inside the trauma bay, the portable X-ray machine was positioned. The team stepped back as the image was captured. Seconds later, it appeared on the monitor. Chest film showing what appeared to be a large hemothorax on the left side, exactly as Brennan had suspected. "Chest tube," Brennan ordered. "We need to decompress that hemothorax now." Rachel's hands clenched. The X-ray was misleading. What looked like blood in the chest cavity was actually the shadow of herniated abdominal organs. A chest tube would do nothing to solve the underlying problem. General Aldridge's eyes suddenly opened. Despite the oxygen mask and the pain medication coursing through his system, his gaze was sharp and focused. He reached up weakly, pulling the mask aside. "No," he rasped. Brennan leaned closer. General, you need to stay calm. We're treating your injuries. Not you. Aldridge's voice was barely audible, but his tone carried absolute authority. I want the best surgeon in this building. Get me the best. Brennan's expression tightened. General, I assure you our team is highly qualified. I said the best. Aldridge's hand shot out, gripping Brennan's wrist with surprising strength. Don't patronize me, doctor. I'm dying. I can feel it. And I'm not going to die because you're following protocol instead of thinking. A tense silence fell over the trauma bay. Nurses exchanged glances. Residents stood frozen, unsure how to respond to a 4-star general essentially firing the chief of trauma surgery. Brennan's jaw worked silently. Then, with visible effort, he said, I'll consult with our senior staff. He stepped out of the trauma bay, his face carefully neutral. Rachel moved back from the window, but Brennan's eyes found her anyway. He studied her for a long moment, clearly weighing options he didn't like. Dr. Kensington, he said finally. A word. They moved to a quiet corner. Brennan kept his voice low. The general is demanding our best surgeon. I have 3 options. Dr. Voss, who's in surgery for the next 4 hours. Dr. Martinez, who specializes in cardiac cases. Or, he paused. Someone tells me you were watching the general's presentation very carefully. Rachel chose her words precisely. I was observing, yes. And I believe the preliminary diagnosis is incomplete. Brennan's eyes narrowed. Explain. The chest X-ray shows what appears to be hemothorax, but the breathing pattern suggests diaphragmatic involvement. The paradoxical abdominal movement, the jugular vein distension despite hypotension, the asymmetrical chest rise, these all point to diaphragmatic rupture with herniation. Rachel met his gaze steadily. A chest tube won't fix that. He needs immediate surgical repair. That's a rare complication. Common in blast injuries, especially with the force required to wound a passenger inside an armored vehicle. Rachel's voice gained confidence. In forward operating bases, we saw this pattern frequently. The blast wave causes a pressure differential that tears the diaphragm. Abdominal contents herniate into the thoracic cavity. Standard imaging misses it because the herniated organs create shadows that mimic hemothorax. Brennan was quiet for a moment. How many of these have you actually treated? 17 confirmed cases. 14 survived. Where? Rachel hesitated. That information is classified. Convenient. Brennan started to turn away. Dr. Brennan, Rachel said sharply, you can doubt my credentials, question my past, even hate me for whatever rumors you've heard. But that man is dying, and you know it. Order a CT scan. 5 minutes. If I'm wrong, you lose nothing. If I'm right, you save a 4-star general. Inside the trauma bay, alarms began sounding. The general's oxygen saturation was dropping. 78%. 74. His breathing became more labored. Brennan made his decision. CT scan, immediate priority. Dr. Kensington, you're consulting on this case. Observation only. Understood? Understood. They moved the general to CT imaging with controlled urgency. Rachel stood in the control room, watching the images appear slice by slice on the screens. There. The telltale signs of diaphragmatic rupture. The stomach and part of the colon were visible in the left thoracic cavity, compressing the lung. Blood pooled around the herniated organs. Jesus, Brennan whispered. You were right. The radiologist pointed at the screen. Complete diaphragmatic rupture, approximately 8 centimeters. Multiple abdominal organs herniated into the thorax. This requires immediate surgical repair. They rushed the general back to the trauma bay. His condition was deteriorating rapidly. Oxygen saturation at 70% and falling. Blood pressure barely maintaining at 65/30. Brennan began issuing orders. Prep OR3. I need a thoraco-abdominal approach setup. Call anesthesia. Tell them we're coming up in 5 minutes. General Aldridge's hand moved weakly, gesturing. Rachel stepped closer, and his eyes locked onto her face. Recognition flashed across his features. I know you, he whispered. Kandahar, the ghost. You saved my men. Rachel's breath caught. The nickname she'd earned during that impossible 36-hour siege. The operation that had ended with 17 children alive, and her career destroyed. Easy, General, she said softly. Save your strength. You're the best, Aldridge said, his voice fading. I want you. Do what you do best. Brennan heard every word. He stared at Rachel with new eyes, calculation mixing with suspicion and something that might have been respect. Dr. Kensington, he said formally, will you lead the surgery? Rachel looked at the general, at the monitors showing his failing vitals, at Brennan's face where doubt and necessity warred. This was why she'd come back. Not for redemption, not for vindication, but for this. A life hanging in the balance, and the skills to save it. Yes, she said. The general's monitor alarmed. Cardiac arrest. His body convulsed once, then went still. Crash cart, Brennan shouted. We're losing him. Rachel was already moving, her hands steady, her mind clear. The ghost of Kandahar was back, and she wasn't going to let anyone die on her watch. The crash cart arrived within seconds. A resident began chest compressions, while another prepared the defibrillator. Rachel moved to the head of the bed, assessing the situation with the cold clarity that had kept her alive in combat zones. Stop compressions, she said. Her voice cut through the chaos with absolute authority. Charging paddles won't help. His heart can't fill properly with a stomach compressing his left lung. Dr. Kensington, Brennan began. But Rachel was already moving. We don't have time to get him to an OR. His brain is dying right now. She turned to a nurse. Emergency thoracotomy tray. Rib spreaders, vascular clamps, everything. Move. The nurse sprinted. Rachel pulled on sterile gloves, her movements economical and precise. Around her, the trauma bay seemed to slow down. She'd been in this space before, the moment between life and death, where seconds stretched into eternities, and every decision carried absolute consequences. Dr. Kensington, Brennan said, his voice tight. You're talking about emergency resuscitative thoracotomy in the trauma bay. That's a last resort procedure with a survival rate below 5%. The alternative is 0%. Rachel accepted the betadine from a nurse and poured it across the general's left chest. He's in cardiac arrest from mechanical compression. We decompress, we get him back. It's that simple. Simple, Brennan repeated. But he didn't stop her. Instead, he moved to assist. What do you need? Keep compressions going until I'm ready to open. Rachel positioned herself at the general's left side. The thoracotomy tray arrived. She selected a scalpel, number 10 blade, and held it over the general's chest at the 5th intercostal space. Doctor. Park appeared at her other side, gloved and ready. I'm assisting. Rachel met her eyes for a fraction of a second. She saw no judgment there, only fierce determination. She nodded once. Compressions stop on my mark, Rachel said. 3, 2, 1, mark. The resident stepped back. Rachel made the incision in one smooth motion, cutting from sternum to mid-axillary line. Blood welled immediately. She cauterized as she went, moving with speed that looked reckless, but was actually the product of hundreds of repetitions under impossible conditions. Rib spreaders, she said. Park positioned them. Rachel cranked them open, and the thoracic cavity revealed itself. There, the pericardium was tense and dark. Blood had accumulated around the heart, adding a second layer of compression. Pericardial window first, Rachel said. He's got tamponade on top of the diaphragmatic rupture. She lifted the pericardium carefully, avoiding the phrenic nerve, and made a longitudinal incision. Dark blood poured out. Park immediately began suctioning. As the fluid evacuated, the general's heart became visible. It was still, but Rachel could see the problem clearly now. The ruptured diaphragm had allowed the stomach to herniate upward, compressing the heart and lung simultaneously. Manual cardiac compression, Rachel said, placing her hand directly on the general's heart. She squeezed rhythmically, forcing blood through the chambers. Park, I need you to hold the pericardium open and retract the herniated stomach. Park complied, her hands steady despite the surreal nature of what they were doing. Brennan watched from across the table, transfixed. Around them, the trauma bay had gone completely silent, except for the monitors and the sound of Rachel's commands. I need to reduce the herniation before I can repair the diaphragm, Rachel said, still maintaining cardiac compressions with her left hand, while using her right to gently manipulate the stomach back through the diaphragmatic tear. This is going to be tight. She worked with focused intensity, her movements precise despite the awkward angle and the continued manual compression. It was like performing surgery with one hand tied behind her back, except the hand wasn't tied. It was literally squeezing a human heart to keep its owner alive. Impossible. Someone whispered from the observation window above. Rachel didn't respond. She'd done impossible before. In Kandahar, she'd operated with one hand while holding pressure on a severed femoral artery with the other. She'd performed amputations by flashlight during power outages. She'd sutured chest wounds while mortar rounds landed close enough to shake surgical instruments off the tray. This was just another version of impossible. And impossible was where she lived. The stomach finally reduced back into the abdominal cavity. Rachel could see the diaphragmatic tear now, 8 centimeters long, ragged edges, actively bleeding from torn blood vessels. "I need to repair this before we can restart the heart," she said. 3/0 silk, pleated sutures. A nurse handed them over. Rachel released the heart momentarily to place the first suture, then resumed compression. Place suture, compress, place suture, compress. A rhythm that required absolute coordination and concentration. Heart rate showing, the anesthesiologist called out. Weak, but there. Rachel felt it under her palm, a flutter of movement. The heart was trying to beat on its own. She placed 2 more sutures, cinching the diaphragmatic tear closed. Not perfect, but enough to restore mechanical function. "Internal paddles," she said. They were placed in her hands immediately. She positioned them on either side of the general's heart. 20 joules. Clear. The shock delivered. The heart contracted once, weakly, then stopped. 30 joules. Another shock. This time, the heart fluttered, contracted twice, stopped again. Rachel resumed manual compression. "He's been without adequate perfusion for 5 minutes. We need to give the cardiac cells time to recover their oxygen debt." She squeezed steadily, counting compressions in her head. 30, 40, 50. "Dr. Kensington," Brennan said quietly. "Even if we get him back, the neurological damage at this point—" "He's not gone until I say he's gone," Rachel interrupted. She continued compressions. 60, 70, 80. The monitor beeped. Once. Then again. Then a regular rhythm appeared, slow but steady. "Sinus rhythm," the anesthesiologist called out, his voice filled with disbelief. "Rate 60, pressure rising, 80/50, 90/60. Rachel kept her hand on the general's heart, feeling it beat against her palm. "Strong, regular, alive. Oxygen saturation climbing," a nurse added. 72%, 78, 85. The heart contracted steadily now, no longer needing Rachel's assistance. She removed her hand slowly, checking the surgical repair. The sutures were holding. No active bleeding. The lung was re-expanding as the chest tube drained residual blood. "He's back," Park whispered. Rachel began closing the thoracotomy incision, placing interrupted sutures with the same precision she'd used for every other step. "We need to get him to ICU immediately. Hypothermia protocol to minimize neurological damage. Target temperature 33 degrees Celsius for 24 hours. Brennan nodded, but he didn't take his eyes off Rachel. That was the most remarkable piece of surgery I've ever witnessed. Rachel tied off the final suture. It was necessary, that's all. They transported the general to ICU. His vitals continued to strengthen during the transfer. By the time they had him settled in the unit, his blood pressure had stabilized at 110/70. Oxygen saturation at 96%. The cooling blankets were positioned, and the hypothermia protocol began. Rachel stripped off her blood-soaked gown in the scrub room. Dr. Park stood beside her, processing everything they'd just done. "How did you learn to do that?" Park asked. "Practice," Rachel said simply. "A lot of practice in places where there was no choice but to succeed." Brennan entered the scrub room. His expression was unreadable. "Dr. Kensington, my office, now." Rachel dried her hands. "Am I being terminated?" "That depends," Brennan said, "on who you really are." By 6 p.m., everyone at Walter Reed knew the story. The temporary contractor with no references had performed an emergency thoracotomy in the trauma bay and brought a 4-star general back from cardiac arrest. The residents whispered about it in the cafeteria. Nurses shared details in the break rooms. Within hours, Rachel Kensington had gone from anonymous contractor to hospital legend. Rachel felt the weight of every stare as she walked through the corridors. Some looks carried admiration, others suspicion. A few held outright hostility, particularly from Dr. Graham Voss, the senior surgeon who'd been in the OR when the general arrived. She'd seen his type before: territorial, insecure, threatened by anyone who challenged his position in the hierarchy. Dr. Park caught up with her outside the ICU. "You've been Googling yourself, haven't you?" "Should I be concerned?" Rachel asked. "Depends on how you feel about conspiracy theories."
Park pulled out her phone. "There's almost nothing about you online. No social media, no published research after 2023, no conference presentations. For a surgeon with your skills, that's unusual. Maybe I value privacy. Or maybe someone scrubbed your digital footprint." Park's eyes were sharp. "I found something, though. A military medical journal from 2022. Article about trauma protocols in austere environments. One of the authors was listed as Lieutenant Colonel R. Kensington, MD, FAX.
Combat Surgical Team, Joint Special Operations Command. Rachel kept her expression neutral. There are probably lots of Kensingtons in the military, with the same specialty and the same first initial? Park shook her head. "I also found references to something called the Kandahar Protocol, a surgical technique for managing mass casualty events under fire. The documentation is mostly redacted, but the operation took place during a 36-hour siege in 2021. 83 lives saved. The lead surgeon earned a nickname, the Ghost." "That's an interesting story," Rachel said carefully. "The general called you that. In the trauma bay. He said, 'You're the Ghost.'" Park moved closer, lowering her voice. "What happened in Kandahar? And why did you disappear?" Before Rachel could answer, her pager vibrated. "ICU. Urgent." She moved quickly down the corridor, Park following close behind. General Aldridge was awake. His eyes tracked their approach, clear and focused despite the medications and the trauma his body had endured. The hypothermia protocol had been initiated successfully, and his vitals remained stable. "Colonel Kensington," he said, his voice rough but strong. "Just doctor now," Rachel replied, checking his monitors. "How are you feeling?" "Like I got blown up and had my chest cracked open." A faint smile crossed his face. "But alive, thanks to you." "You should rest, General. Your body needs time to heal." In a minute, Aldridge's hand moved weakly toward her. "First, I need to say something. They buried you for saving my men. For doing the right thing when command wanted something else. I couldn't stop it then. I was deployed, caught in political crossfire, but I can stop it now." Rachel's jaw tightened. "General, this isn't the time. It's exactly the time. I'm going to make this right." His eyes held absolute determination. "You saved my life twice. Once in Kandahar, when you operated on my security detail under chemical attack, and now, I don't forget debts like that." Dr. Park stood frozen, absorbing every word. Rachel could feel her carefully constructed anonymity crumbling. "Rest," Rachel said firmly. "We'll talk when you're stronger." She left the ICU quickly, but the damage was done. Park caught up with her in the stairwell. "Chemical attack?" Park said. "He said you operated under chemical attack. That's not just combat surgery. That's classified," Rachel interrupted. "Everything about that operation is classified. I can't discuss it." "But it destroyed your career." "It complicated my career." Rachel's voice hardened. "And I'd appreciate it if you'd let it stay in the past where it belongs." Park studied her for a long moment. Then, unexpectedly, she nodded. "Okay. But for what it's worth, whatever you did, it must have been pretty heroic for a 4-star general to remember you 3 years later." At 8:45 p.m., Rachel was reviewing patient charts in the residence lounge when the trauma alert sounded again. "Incoming medevac, ETA 2 minutes. Single casualty from Afghanistan, General Aldridge's convoy. Delayed symptoms, respiratory distress." Rachel's head snapped up. She remembered what the paramedics had said. Multiple casualties from the IED blast. General Aldridge had been the most critical, but he wasn't the only victim. She reached the trauma bay as the helicopter landed. Paramedics rushed in with a gurney carrying a man in his 30s, wearing the uniform of an army major. His name tape read Cordero. His face was flushed, breathing labored, oxygen saturation at 88%. Dr. Voss took charge, moving with practiced efficiency. What's his presentation? Major Elias Cordero, Army Intelligence, the paramedic reported. Was in the vehicle behind General Aldridge during the IED blast. Walked away with minor contusions. Cleared by field medics. Started developing respiratory symptoms 6 hours ago, progressively worsening during transport. Rachel moved closer, studying Cordero's presentation. Fever, tachypnea, bilateral rales on auscultation. But something else caught her attention. Small papular lesions on his exposed forearms, clustered and inflamed. "Dr. Voss," she said. "Those skin lesions. When did they appear?" Voss glanced at her with barely concealed irritation. "Dr. Kensington, this is my case. I understand. But those lesions are clinically significant. They're minor abrasions from the blast." "No," Rachel pointed at the pattern. "Abrasions don't cluster like that. And they don't cause systemic symptoms this severe." Voss's jaw clenched. "Your opinion is noted." Rachel watched him work, her concern growing. He was treating this as blast-related pneumonitis with possible secondary infection. Standard antibiotics, supportive care, observation. But the presentation was wrong. The timeline was wrong. The skin lesions were wrong. She'd seen this before, not in the United States, but in field hospitals where biological agents were still used as weapons of war. Rachel pulled Dr. Park aside. "I need you to run specific labs on Cordero. Full blood count with differential, inflammatory markers, and most importantly, serology for tularemia and Q fever. You think this is biological?" "I think that IED blast wasn't standard ordnance." Rachel kept her voice low. "The delayed respiratory symptoms, the papular lesions, the high fever, it's consistent with aerosolized bacterial exposure. If I'm right, there may be more casualties coming, and we're not prepared." Park's face paled. "I'll get the labs ordered. But Voss is going to fight you on this. Then we'll fight back." Rachel looked at Major Cordero, whose oxygen saturation was continuing to drop despite supplemental oxygen. "Because if this is what I think it is, we have less than 48 hours to figure out treatment before people start dying." Rachel didn't sleep that night. She sat in the hospital library, pulling research articles on weaponized bacterial agents, cross-referencing symptoms, building a diagnostic framework. By 3 a.m., she had a working hypothesis. By 5 a.m., she had a treatment protocol. By 6 a.m., 3 more soldiers from General Aldridge's convoy arrived at Walter Reed with identical symptoms. Sergeant First Class Maria Torres came in first, carried by her husband, a civilian contractor. Her oxygen saturation was 82%. Her skin showed the same papular lesions Rachel had seen on Cordero. Her fever spiked at 103.4 degrees. Lieutenant James Whitmore arrived 30 minutes later by ambulance, his breathing so labored that paramedics had to intubate him in transit. Oxygen saturation 79%. Bilateral infiltrates on chest X-ray. The same pattern of skin lesions. Corporal Devin Mitchell was the third, a communications specialist who'd been riding in the trail vehicle. He was still conscious, still fighting, but his oxygen saturation was dropping steadily, despite maximum supplemental oxygen. Dr. Park found Rachel in the ICU, where all 4 patients had been isolated in negative pressure rooms. "The labs came back on Cordero. You were right. Tularemia serology is positive. Francisella tularensis, weaponized strain based on the antibiotic resistance profile." Rachel's jaw clenched. "Rabbit fever, engineered to bypass standard treatments. CDC is on their way. They want to quarantine the entire trauma unit." Park's voice shook slightly. "Rachel, if this is weaponized, if it's contagious, it's not person-to-person transmissible." The exposure was at the blast site. Rachel pulled up imaging on her tablet, showing it to Park. "See this pattern? Inhalation exposure. They breathed it in when the IED detonated. It's been incubating for 36 hours. Now it's hitting the acute phase. How do we treat it?" "That's the problem. Standard protocols use streptomycin or gentamicin, but weaponized strains are specifically engineered to resist those antibiotics." Rachel opened her research files. "I worked with tularemia cases in Syria. We developed an alternative protocol, combination therapy with fluoroquinolones and doxycycline, plus hyperbaric oxygen to combat the pneumonic complications." Dr. Brennan appeared in the doorway, his face grave. "Dr. Kensington. Conference room." Now. The conference room was packed. Brennan sat at the head of the table. Dr. Voss was there, arms crossed, expression hostile. 2 CDC representatives in suits occupied the far end. A military liaison officer stood near the door, phone in hand. Dr. Kensington, Brennan began. The CDC has confirmed your diagnosis. Weaponized tularemia, likely dispersed via IED in Afghanistan. 4 confirmed cases, all critical. Standard treatment protocols are ineffective due to engineered antibiotic resistance. He paused. You've proposed an alternative protocol. Yes. Rachel stood, connecting her tablet to the conference room display. Combination therapy, ciprofloxacin and doxycycline, high dose, plus hyperbaric oxygen therapy to increase tissue oxygenation and enhance antibiotic penetration. I used this protocol in 2022 during a suspected bioweapon exposure in Syria. Survival rate was 78%. One of the CDC representatives, Dr. Sarah Chen, leaned forward. That protocol isn't FDA approved for tularemia treatment. Because tularemia hasn't been weaponized on U.S. soil before, Rachel countered. The standard protocols were developed for naturally occurring strains. This isn't natural. Your Syrian operation isn't in any published literature, Dr. Voss interjected. How do we know you didn't just fabricate this data? Rachel's eyes locked onto his. You don't. You have to trust that I know what I'm doing because I've done it before under worse conditions. Trust isn't evidence-based medicine, Voss said coldly. Neither is watching patients die while we wait for peer review. Rachel turned back to Brennan. Those 4 soldiers have maybe 48 hours before multi-organ failure sets in. We don't have time for clinical trials. We need to act now. The room fell silent. The military liaison stepped forward. Dr. Kensington, I've been authorized to share classified information with this group. He opened a secure tablet. The IED that hit General Aldridge's convoy was specifically designed to target him. Intelligence suggests it was placed by insurgent forces with access to biological weapon stockpiles. The general was investigating corruption in military supply chains. Someone didn't want him to continue. Rachel's mind raced. Supply chains? Medical supplies? Among other things. She looked at Dr. Voss, whose face had gone carefully blank. A cold realization settled over her. Dr. Chen from the CDC spoke up. Dr. Kensington, even if your protocol works, we can't authorize it without proper oversight. The liability alone is nothing compared to 4 dead soldiers, Rachel interrupted. We need approval from the FDA, the Department of Defense, and Walter Reed's Ethics Committee, Chen continued. That process takes weeks. They'll be dead in 48 hours. Brennan stood. Dr. Chen, with all due respect, Walter Reed operates under both civilian and military authority. If we can get military authorization, I can get it. General Aldridge stood in the doorway, leaning on a nurse for support. He was pale, attached to portable monitors, but his voice carried absolute authority. I'm invoking emergency medical protocols under Title 10, USC, Section 1107. Dr. Kensington's protocol is approved for immediate implementation. Dr. Chen started to protest. General, you're a patient here. You don't have the authority. I'm a 4-star general with command authority over special operations medicine. I absolutely have the authority. Aldridge moved slowly into the room. Dr. Kensington saved my life yesterday using techniques that weren't in any textbook. Those 4 soldiers are my people. If she says she can save them, I'm giving her the chance. Voss stood abruptly. This is insane. We're bypassing every safety protocol. We're saving lives, Aldridge said flatly. Dr. Kensington, you have full authorization. Whatever you need, you get it. Understood? Rachel nodded. Understood, sir. Good. Aldridge turned to leave, then paused. And doctor? Don't let them die. I've already lost too many people because of this corruption. I'm not losing more. 20 minutes later, Rachel stood in the hyperbaric oxygen chamber control room. All 4 patients were positioned in individual chambers, connected to ventilators and IV lines delivering the antibiotic combination. Dr. Park monitored vitals while Rachel adjusted oxygen pressures. This is either going to work, Park said quietly, or we're going to watch 4 people die in sealed chambers. It'll work, Rachel said, with more confidence than she felt. The treatment began. For the first 3 hours, nothing changed. Oxygen saturations remained critically low, Fevers persisted. Rachel watched the monitors, making minute adjustments, calculating drug concentrations in her head. At hour 4, Corporal Mitchell's oxygen saturation ticked up. 81%. 83. 85. It's working, Park breathed. By hour 6, all 4 patients showed improvement. Fevers began dropping. Breathing patterns stabilized. The skin lesions started to fade. Rachel allowed herself a single moment of relief. Then she checked the protocols again. They weren't out of danger yet. The next 48 hours would determine survival. But they had a chance now. A fighting chance. And in medicine, sometimes that was all you needed. At 2 a.m. on the second day of treatment, Rachel reviewed the attack reports in the hospital's secure conference room. Something didn't add up. The IED placement, the timing, the specific targeting of General Aldridge's vehicle. It all suggested detailed intelligence that insurgent forces shouldn't have possessed. Dr. Park entered with coffee and a laptop. I've been digging into the medical supply chain that General Aldridge was investigating. Found something interesting. Rachel accepted the coffee gratefully. What did you find? A defense contractor called Medicorps International. They supply field medical equipment to special operations units. 3 months ago, there were complaints about substandard supplies, expired medications, defective surgical instruments, contaminated IV fluids. Park pulled up documents on her screen. The complaints were filed by military physicians, but they never went anywhere. Someone buried them. Who signed off on the Medicorps contracts? Park hesitated. That's where it gets complicated. The approval chain includes Pentagon procurement officers, military medical command, and several senior physicians at Walter Reed who served as clinical advisors. She pulled up a list of names, including Dr. Graham Voss. Rachel's blood went cold. Voss was on the approval committee? More than that. He personally signed off on 3 major Medicorps contracts over the past 2 years. Contracts worth $40 million. Park lowered her voice. Rachel, if those supplies were substandard, and Voss approved them anyway, he's not just corrupt. He's responsible for deaths. Rachel thought back to Kandahar. The expired medications that didn't work. The surgical instruments that broke during critical procedures. The IV fluids that caused infections. She'd filed reports, demanded investigations, refused to use the equipment. And 18 months later, she'd been dishonorably discharged for unauthorized medical procedures and insubordination. It wasn't just about medical decisions, Rachel said quietly. They discharged me because I was exposing the corruption. Before Park could respond, an alarm sounded from the ICU. Rachel sprinted down the corridor, Park close behind. In the hyperbaric chamber bay, Lieutenant Whitmore's monitors showed deteriorating vitals. Oxygen saturation dropping, heart rate climbing, blood pressure falling. Rachel checked the chamber controls. Everything appeared normal. Oxygen pressure at therapeutic levels, temperature stable, antibiotic infusion running correctly. But Whitmore was crashing. Pull him out, Rachel ordered. Something's wrong. The chamber depressurized. Nurses wheeled Whitmore to the main ICU. Rachel examined him quickly. His pupils were dilated. His breathing was rapid and shallow. His skin showed signs of a severe allergic reaction, hives, angioedema, respiratory distress. Anaphylaxis, Rachel said. But to what? We've had him on this protocol for 18 hours without any reaction. Dr. Park checked the IV bags. She held one up to the light, and her face went pale. Rachel, look at this. The bag's medication label was correct. Ciprofloxacin, 400 millimol. But the fluid inside had a faint, cloudy appearance that shouldn't be there. Park drew a sample with a syringe and examined it closely. This isn't ciprofloxacin, she said. The consistency is wrong. The color is slightly off. She ran to the lab with the sample. Rachel stayed with Whitmore, administering epinephrine and antihistamines to counter the allergic reaction. Park returned 20 minutes later, her expression grim. The lab confirmed it. Someone switched the medication. That IV bag contained a V-lactam antibiotic, specifically one that Whitmore's chart clearly states he's severely allergic to. Rachel's mind raced. Who had access to the medication? Pharmacy prepared it. It was delivered to the ICU. Any number of people could have switched it. Park paused. But Rachel, this wasn't a mistake. Someone deliberately tried to kill him. Rachel looked at the 3 other patients, still in their hyperbaric chambers. Check every IV bag, every medication. Do it now. Park coordinated with the nursing staff. Within 30 minutes, they'd discovered 2 more tampered medication bags, both labeled correctly, but containing wrong drugs. One would have caused fatal arrhythmia in Corporal Mitchell. The other would have triggered a stroke in Sergeant Torres. Someone was actively sabotaging the treatment. Rachel called an emergency meeting in Brennan's office. Only a small group attended. Brennan, Park, General Aldridge, who'd insisted on being present despite his condition, and 2 military investigators. 3 of 4 patients were targeted, Rachel explained. The medications were switched between pharmacy and administration. This is deliberate sabotage. One of the investigators, Major Sarah Collins, pulled out her tablet. We've been running background checks on all personnel with access to the ICU. One name keeps appearing in connection with Medicorps International. She turned the screen to face them. Dr. Graham Voss. Brennan's face hardened. Graham has been with Walter Reed for 15 years. He's respected, accomplished, and corrupt. General Aldridge interrupted. I've seen the evidence. Voss approved contracts for substandard medical supplies. He received consulting fees that were actually kickbacks. When military physicians complained, he buried their reports. The general's voice was ice. Dr. Kensington was one of those physicians. She refused to use Medicorps equipment in Kandahar because it was killing her patients. Voss had her discharged to silence her. Rachel felt vindication and rage in equal measure. 18 months of shame, of doubt, of wondering if she'd actually been wrong. And now the truth. She'd been right all along. Where is Voss now? Rachel asked. Major Collins checked her phone. According to hospital security logs, he accessed the ICU pharmacy 20 minutes ago. Rachel was already moving. She reached the ICU at a run, Park beside her. The pharmacy door was ajar. Inside, Voss stood at the medication prep station, a syringe in his hand, leaning over an IV bag marked for Corporal Mitchell. Step away from that medication, Rachel said, her voice deadly calm. Voss turned. For a moment, his professional mask remained in place. Then it cracked, revealing something ugly beneath. You should have stayed gone, Kensington. You had your chance to disappear quietly. What's in the syringe? Nothing that concerns you. Voss moved toward the door, but Rachel blocked his path. You killed soldiers in Kandahar with your substandard supplies. You're not killing more here. Voss's face twisted with contempt. Those contracts were worth millions. Do you have any idea how much money was involved? And you wanted to throw it away over some expired medications and defective instruments. You were always too self-righteous for your own good. Security arrived, along with Major Collins and 2 military police officers. They took the syringe from Voss's hand. His expression shifted from defiance to calculation, to resignation. Dr. Graham Voss, Major Collins said formally, you're under arrest for conspiracy to commit murder, fraud, and violations of the Uniform Code of Military Justice. You have the right to remain silent. As they led Voss away, he looked back at Rachel. You think this vindicates you? You're still the surgeon who chose civilians over soldiers. That truth doesn't change. Rachel met his eyes steadily. I chose medicine over profit. That's the truth that matters. After Voss was removed, Rachel returned to the ICU. Whitmore had stabilized. The other 3 patients continued improving. By morning, all 4 would be out of immediate danger. But Rachel knew this wasn't over. Voss was just one part of a larger network. The corruption ran deeper. And somewhere, people were still dying because of substandard supplies. General Aldridge found her in the observation room, watching the patients sleep. They're going to survive, he said. Because of you. Because you gave me the authority to treat them. I gave you what you should have had all along. Trust. Aldridge paused. I'm reopening the investigation into your discharge. By next week, you'll be fully exonerated and reinstated with full honors. Rachel looked at the sleeping soldiers. I don't want honors. I want to make sure this never happens again. Then help me finish what I started. Help me burn this corruption to the ground. Rachel nodded slowly. The fight wasn't over. It was just beginning. The news of Voss's arrest spread through Walter Reed like wildfire. By morning, reporters had gathered outside the hospital, camera crews jostling for position. Rachel watched from a 4th-floor window as security tried to maintain order. The story was too big to contain. Corruption in military medical supply chains, attempted murder of soldiers, A disgraced surgeon vindicated. Dr. Park found her in the doctor's lounge. "You need to see this." She pulled up a news website on her tablet. The headline read, "Walter Reed surgeon arrested in corruption scandal." But the subheadline made Rachel's blood run cold. "Controversial former Army doctor at center of investigation." The article detailed Voss's arrest, but it also dredged up Rachel's past. Her discharge, the Kandahar incident, the accusations of insubordination and unauthorized procedures. The reporter had spun it to suggest that Rachel might be involved in the corruption herself, using the crisis to deflect from her own misconduct. "They're making you the villain," Park said quietly. "They're making me the distraction." Rachel set down the tablet. "Someone leaked my classified records. That information shouldn't be public. Who would benefit from discrediting you right now?" Rachel thought about the corruption network. Voss was just one piece. There were others: Pentagon procurement officers, defense contractor executives, military command officials who'd benefited from the arrangement. They needed Rachel to look unreliable, unstable, someone whose accusations couldn't be trusted. "Everyone connected to Medicorp," Rachel said. "If I'm discredited, anything I say about the corruption can be dismissed." Her phone buzzed. A text from an unknown number. "You should have stayed quiet. This is just the beginning." Rachel showed it to Park, who immediately called hospital security. Within minutes, military investigators were analyzing the message, but Rachel knew they wouldn't find anything. These people were professionals. They covered their tracks. In the ICU, the 4 soldiers continued recovering. Corporal Mitchell was off the ventilator, breathing on his own. Sergeant Torres was sitting up, color returning to her face. Lieutenant Whitmore's allergic reaction had resolved. Major Cordero was weak but stable. Rachel checked each patient personally, reviewing charts, adjusting medications, answering questions. When she reached Cordero's room, he was awake and alert. "Dr. Kensington," he said, his voice still raspy. "I heard what happened. What Voss tried to do." He paused. "I also heard what they're saying about you in the news. Don't believe everything you read." "I don't. I believe what I see." Cordero met her eyes. "You saved my life. You saved all of us. Whatever happened in your past, you're a hero in my book." Rachel felt unexpected emotion tighten her throat. "Just doing my job, Major." "No. You went beyond your job. You put your reputation on the line, your career, maybe your freedom. That's not duty. That's courage." After leaving the ICU, Rachel was summoned to Brennan's office. She expected another crisis, but instead found General Aldridge waiting with Dr. Park and Major Collins. "Sit down, Dr. Kensington," Aldridge said. He looked stronger than before, his color improved, though still obviously recovering. "We need to discuss the media situation." "I'm aware I've become a liability," Rachel said. "You've become a target," Aldridge corrected. "The people behind Medicorp are trying to destroy your credibility before you can testify against them. They leaked your classified records. They're feeding stories to friendly journalists. And based on threat analysis, they may be planning something more direct." Rachel absorbed this. "You think I'm in danger?" "I think you're the only person who can expose the full scope of the corruption," Major Collins said. "You were there in Kandahar. You saw the defective supplies. You filed the reports that were buried. You have first-hand evidence that connects battlefield deaths to the contract fraud. That makes you extremely dangerous to some very powerful people. Which is why we're assigning you protective detail," Aldridge added. 2 military police officers, round the clock, until this is resolved. "That's not necessary. It's not negotiable," Aldridge said firmly. "Dr. Kensington, you've already been discharged once for threatening their profits. They won't hesitate to eliminate you permanently if they think you're a threat." Dr. Park leaned forward. "There's something else. I've been reviewing security footage from the past week. Someone's been following you. Different people, different times, but always maintaining surveillance. Professional grade." Rachel thought about the feeling she'd had several times recently, the sense of being watched. She dismissed it as paranoia. "How long?" "Since the day you arrived at Walter Reed." The implication settled over Rachel like a weight. They'd been tracking her from the beginning, waiting to see what she'd do. And when she'd saved General Aldridge and started treating the tularemia patients, she'd become too dangerous to ignore. "I want to hold a press conference," Rachel said suddenly. Everyone turned to stare at her. Absolutely not, Brennan said. That would be strategic, Rachel interrupted. They're trying to control the narrative, make me look unreliable. But if I go public with the full story, Kandahar, the defective supplies, the buried reports, Voss's sabotage, I take away their ability to control the message. Everything becomes public record. If something happens to me after that, it'll be obvious who's responsible. Aldridge considered this. It's risky. You'll be exposing yourself to intense scrutiny. Every decision you've ever made will be questioned. They're already questioning them. At least this way, I get to tell the truth on my own terms. Major Collins nodded slowly. It could work. If we time it right, coordinate with the military investigators, use the press conference to announce formal charges against the Medicorps network, we'd be forcing their hand, Aldridge finished. They'd have to either back down or escalate. And if they escalate publicly, they're finished. Brennan stood. I'll coordinate with Walter Reed's public affairs office. We can schedule the press conference for tomorrow afternoon. That gives us time to prepare statements and notify the appropriate authorities. As the meeting broke up, Dr. Park pulled Rachel aside. Are you sure about this? Once you go public, there's no going back. Rachel thought about the soldiers in the ICU, about the lives lost in Kandahar, about 18 months of shame and silence. I've been hiding long enough. It's time to fight back. That evening, Rachel sat in her temporary quarters at Walter Reed, preparing her statement for the press conference. Outside her door, 2 military police officers stood guard. Her phone buzzed constantly, messages from reporters requesting interviews, emails from colleagues offering support or condemnation, calls from blocked numbers that she didn't answer. She pulled out a photograph she'd carried since Kandahar. 17 children, survivors of the chemical attack, smiling at the camera. Behind them stood Rachel and her surgical team, exhausted but alive. She'd saved those children by refusing to use the substandard supplies Voss had approved. She'd chosen their lives over her career, and she'd do it again. Tomorrow the world would know why. The press conference was scheduled for 2 p.m. in Walter Reed's main auditorium. By noon, the room was packed with journalists, cameras, and military officials. Rachel stood backstage with Dr. Park, reviewing her statement one final time. Her hands were steady, but her heart raced. You don't have to do this, Park said quietly. There are other ways. No, Rachel said. There aren't. This is the only way to make sure the truth comes out. General Aldridge appeared, walking without assistance for the first time since his surgery. Dr. Kensington, the military investigators have just arrested 3 Pentagon procurement officers and 2 Medicorps executives. The network is collapsing. Your testimony will seal the case. What about the people still in the shadows? Rachel asked. The ones who ordered my discharge, who tried to silence me? We're getting there, but we need your statement on record first. Aldridge paused. Rachel, what you're about to do will change your life. People will view you differently. Some will call you a hero. Others will call you a traitor for exposing military failures. Are you ready for that? Rachel thought about the children in Kandahar, the soldiers in the ICU, the lives saved and the lives lost. I stopped caring what people call me when I learned that telling the truth matters more than protecting reputations. At 2 p.m., Rachel walked onto the stage. Camera flashes erupted. Questions were shouted before she even reached the podium. Dr. Brennan stood at the microphone, calling for order. Thank you for coming, Brennan began. Today, Walter Reed National Military Medical Center is addressing serious allegations regarding medical supply chain corruption that has impacted military personnel deployed in combat zones. Dr. Rachel Kensington, a trauma surgeon with extensive combat experience, will provide testimony regarding her first-hand observations. He stepped aside. Rachel took the podium. The room fell silent. My name is Lieutenant Colonel Rachel Kensington, she began, her voice clear and steady. 18 months ago, I was dishonorably discharged from the United States Army Medical Corps for insubordination and unauthorized medical procedures. Today, I'm here to tell you why. She detailed everything. The deployment to Kandahar, the chemical attack, the 17 children she'd saved using her own medical supplies because the officially approved equipment was defective, the expired medications that didn't work, the surgical instruments that broke during operations, the IV fluids contaminated with bacteria. I filed reports, Rachel continued. detailed documentation of every defective item, every preventable death, every contract violation. Those reports were buried by senior officers who had financial relationships with Medicorp International, the defense contractor supplying the equipment. The room erupted with questions. Rachel raised her hand for silence. I was discharged not because I violated protocols, but because I exposed corruption worth hundreds of millions of dollars, because I chose patient safety over profit margins, because I refused to be silent while soldiers died from treatable injuries using substandard equipment. She pulled out documents, holding them up for the cameras. These are the original reports I filed in 2023. These are the approval signatures from officers who received consulting fees from Medicorp. These are the death certificates of soldiers who died from complications directly linked to defective supplies. A reporter shouted, "Dr. Kensington, are you saying the Army knowingly allowed soldiers to die?" "I'm saying that corruption exists at every level when profit is prioritized over human life," Rachel replied. "And I'm saying that I was punished for trying to stop it." She detailed Voss's sabotage, the weaponized tularemia attack, the attempted murder of the 4 soldiers under her care. She explained how the same network that had buried her reports had tried to kill witnesses who could expose them. General Aldridge was targeted because he reopened the investigation into Medicorp, Rachel said. The IED that nearly killed him wasn't random. It was deliberate assassination disguised as an insurgent attack. The biological weapon dispersed in that blast was designed to eliminate everyone in his convoy who might have evidence. The auditorium was in chaos now. Reporters shouting, cameras flashing, military officials conferring urgently in the back rows. Rachel pressed on. "I'm here today because 4 soldiers are alive in the ICU upstairs. Because I used techniques developed in combat zones to save them. Because I refused to let corruption win." She paused, meeting the cameras directly. "And I'm here to tell anyone else who's been silenced, threatened, or discharged for telling the truth. You're not alone. And this fight isn't over." She stepped back from the podium. The room exploded with questions, but Dr. Brennan moved forward to field them, while Rachel exited through the side door. In the hallway, Dr. Park was waiting with a tablet. It's already trending. Every major news network is picking it up. Social media is exploding. Rachel leaned against the wall, suddenly exhausted. "It's done." "Not quite." Major Collins appeared, her expression grave. "Dr. Kensington, we have a problem. 10 minutes ago, a federal warrant was issued for your arrest." Rachel's blood went cold. "On what charges?" "Unauthorized disclosure of classified information, theft of government documents, and violation of the Espionage Act." Collins showed her the warrant. "Someone in the Pentagon moved fast. They're calling this a national security breach." "That's insane," Park said. "Everything she disclosed was about corruption, not operational security." "Doesn't matter. The warrant is legal." Collins looked at Rachel. "You have 2 options. Surrender to federal authorities now, or we can fight this through military channels. But either way, you're going to be arrested." Rachel thought about the photograph of the 17 children, about the soldiers upstairs, about 18 months of silence and shame. "I surrender, but I want it on record that I stand by every word I said in there. We'll make sure of it," Collins promised. Within an hour, federal agents arrived. They were professional, almost apologetic, as they read Rachel her rights and placed her in handcuffs. The image was captured by a dozen cameras. Dr. Rachel Kensington, the surgeon who'd saved a 4-star general, being led away in restraints. But something unexpected happened. As she was escorted through the hospital corridors, staff members stopped what they were doing. Doctors, nurses, residents. They lined the hallways, silent and watching. Then one nurse started clapping, then another, and another. By the time Rachel reached the exit, the entire corridor was applauding. Some had tears in their eyes. Others saluted. It wasn't loud or theatrical. It was quiet, dignified, and absolutely devastating in its sincerity. "Doctor..." Park walked beside her as far as she was allowed. "We're going to fix this," she said fiercely. "All of us. Every physician who's ever seen this corruption. We're going to testify. We're going to fight." Rachel managed a small smile. "I know you will." As she was placed in the federal vehicle, Rachel looked back at Walter Reed. In a 4th-floor window, she saw the 4 soldiers she'd saved: Corporal Mitchell, Sergeant Torres, Lieutenant Whitmore, Major Cordero. They stood together, watching her leave, their right hands raised in salute. Rachel straightened her shoulders. She'd told the truth. She'd saved lives. She'd fought the fight that needed fighting. Whatever came next, she was ready. The vehicle pulled away, cameras tracking its movement. Behind them, Walter Reed stood as a testament to every battle fought within its walls, both surgical and moral. And in the ICU, Dr. Lena Park pulled out her phone and began making calls. The fight, as Rachel had said, wasn't over. It was just beginning. The federal detention facility was nothing like Rachel had imagined. Clean, bureaucratic, coldly efficient. She was processed, photographed, fingerprinted, and placed in a holding cell with white walls and fluorescent lighting that never dimmed. Through the small window, she could see news helicopters circling overhead. Her arrest had become a national story. Dr. Park visited the next morning, escorted by military police. She looked exhausted, her eyes red from lack of sleep. "The entire medical community is rallying," she said through the glass partition. "Physicians from across the country are signing petitions. Military surgeons are coming forward with their own stories of defective supplies and buried reports. Rachel, you started something." "I started a war I might not win," Rachel replied. "You've already won. Medicor stock has crashed. 3 more executives have been arrested. The Pentagon has suspended all contracts pending investigation." Park leaned closer. "And the Secretary of Defense just announced a full review of military medical procurement going back 10 years. Before Rachel could respond, her attorney arrived, a military defense counsel named Captain James Morrison, assigned by General Aldridge. He was young, sharp-eyed, and carried a briefcase thick with documents. "Dr. Kensington," he said, settling into the chair beside Park. "We have 72 hours until your preliminary hearing. The charges are serious: unauthorized disclosure of classified information and violation of the Espionage Act. But we have a defense, which is whistleblower protection. You disclosed information about criminal activity, not operational secrets. Everything you revealed was about fraud, corruption, and threats to military personnel. All protected categories under federal law." Morrison pulled out documents. "We also have something else. Dr. Park has been collecting affidavits from military physicians who witnessed the same problems you reported. 23 doctors so far, all willing to testify." Rachel felt hope flicker for the first time since her arrest. "That's not enough to counter an Espionage Act charge." "No, but this is." Morrison pulled out a classified document with multiple redaction marks. General Aldridge personally declassified portions of the Kandahar after-action reports. "They show that your unauthorized procedures saved 83 lives during the chemical attack. They also show that the defective equipment you refused to use had already caused 14 preventable deaths in previous operations. The review board needs to see that you weren't insubordinate," Park added. "You were the only person following actual medical ethics while everyone else prioritized politics and profit." The preliminary hearing took place 3 days later in a federal courthouse under heavy security. The courtroom was packed with supporters, protesters, and media. Rachel wore prison-issued clothing, her hands unbound but under constant guard. Across the aisle sat federal prosecutors, their expressions confident. Judge Margaret Harrison presided, a stern woman in her 60s with a reputation for no-nonsense jurisprudence. She reviewed the charges, then turned to the prosecution. "The government will present its case." The lead prosecutor, Assistant U.S. Attorney David Chen, stood. "Your Honor, Dr. Kensington willfully disclosed classified military operations during a public press conference. She revealed information about medical supply chains that could compromise troop safety. She stole government documents and distributed them to media outlets. These are clear violations of federal law." He presented evidence, transcripts of Rachel's press conference, copies of the documents she'd held up, analysis from Pentagon security officials claiming her disclosures created operational risks. "Dr. Kensington claims she was exposing corruption," Chen continued. "But whistleblower protections don't extend to the unauthorized disclosure of classified information. The law is clear. She broke it." Captain Morrison stood for the defense. "Your Honor, Doctor. Kensington disclosed information about criminal fraud that resulted in the deaths of American service members. Under the Whistleblower Protection Act and the Military Whistleblower Protection Act, she is legally protected when reporting fraud, waste, and abuse. even if some information is classified. He called his first witness, General Victor Aldridge. The courtroom stirred as the general entered, still visibly recovering, but moving with military bearing. He was sworn in and took the stand. General Aldridge, Morrison began, you were investigating Medicorp International before the IED attack. What did you discover? Systematic fraud, Aldridge replied, his voice carrying authority. Medicorp was supplying substandard equipment to special operations units. Expired medications, defective surgical instruments, contaminated supplies. They knew the equipment was inadequate, but they delivered it anyway, because replacing it would cut into profit margins. How many deaths resulted? We've documented 43 preventable deaths directly linked to Medicorp equipment failures between 2021 and 2024. The actual number is likely much higher. Morrison pulled up a document. And Dr. Kensington's reports from Kandahar. Did they accurately describe these problems? Yes. She was the first to formally document the pattern. Her reports were comprehensive, detailed, and medically sound. They should have triggered immediate investigations. Aldridge paused. Instead, they were buried by officers who had financial relationships with Medicorp, including Dr. Graham Voss? Yes. Dr. Voss received over $200,000 in consulting fees from Medicorp while approving their contracts. When Dr. Kensington refused to use their equipment, she became a threat to a very lucrative arrangement. The prosecution cross-examined aggressively, but Aldridge held firm. His testimony was devastating. A 4-star general confirming corruption at the highest levels. Morrison called additional witnesses. Dr. Park testified about finding the switched medications and Voss's sabotage attempts. Major Collins detailed the arrests and ongoing investigation. Each witness built a picture of systemic corruption and Rachel as the lone voice trying to stop it. Then Morrison did something unexpected. He called the 4 soldiers Rachel had saved. Corporal Mitchell testified first, still weak but determined. Dr. Kensington saved my life using techniques no one else at Walter Reed knew. She didn't follow standard protocols because standard protocols would have killed me. I'm here because she had the courage to do what was right instead of what was safe. Sergeant Torres, Lieutenant Whitmore, and Major Cordero followed, each telling similar stories. Their testimony was powerful, emotional, and impossible to dismiss. Finally, Morrison called Rachel herself. She took the stand, aware of every camera, every eye in the courtroom. Morrison began gently. Dr. Kensington, why did you hold that press conference? Because soldiers were dying, and the people responsible were trying to silence me, Rachel said. I'd already been discharged once for telling the truth. I wasn't going to let it happen again without making sure the public knew what was at stake. Did you disclose operational secrets? No. I disclosed fraud. Criminal fraud that cost American lives. The prosecutor rose for cross-examination. Dr. Kensington, you admit you disclosed classified information without authorization. I disclosed evidence of crimes. That's protected activity. You're not a lawyer. You don't get to decide what's classified and what's not. I'm a doctor. I do get to decide when unethical practices are killing my patients. The exchange grew heated, but Rachel never wavered. She answered every question with calm precision, making it clear she understood exactly what she'd done and why. Judge Harrison called for closing arguments. The prosecutor argued for strict interpretation of classification laws. Morrison argued for whistleblower protections and public interest. Then the judge made her ruling. This court finds that Dr. Kensington's disclosures, while technically involving classified information, fall under protected whistleblower activity. The information disclosed pertained to criminal fraud affecting military personnel safety. The public interest in exposing such fraud outweighs the government's interest in maintaining classification. She paused. All charges are dismissed. Dr. Kensington is free to go. The courtroom erupted. Rachel felt tears stream down her face as Captain Morrison gripped her shoulder. Across the aisle, the prosecutors looked stunned. Outside, supporters cheered. News helicopters captured Rachel walking free, Dr. Park beside her, General Aldridge waiting with a salute. "Welcome back, Colonel," he said. Rachel returned the salute, smiling through her tears. The fight was over, and she'd won. 1 week after the charges were dismissed, Rachel stood in the Pentagon's Hall of Heroes, surrounded by military brass, government officials, and media cameras. The ceremony had been arranged quickly. Too quickly, she thought. but General Aldridge had insisted. "The Army needs to publicly acknowledge what was done to you," he'd said. "And more importantly, what you did for all of us." Now Rachel wore her Army dress uniform for the first time in 18 months, the fabric feeling both familiar and foreign against her skin. The patches had been restored. Lieutenant Colonel rank, Medical Corps insignia, combat deployment badges. On her chest, a space had been prepared for the decoration she'd refused 3 years ago. The Secretary of Defense stepped to the podium. Lieutenant Colonel Rachel Kensington's actions in Kandahar during the 2021 chemical attack saved 83 lives under conditions that tested the limits of medical capability and human endurance. Her subsequent efforts to expose systemic corruption in military medical supply chains prevented countless additional casualties and led to the prosecution of individuals who had betrayed the trust of our service members. He lifted the silver star from its case. "For conspicuous gallantry and intrepidity in action against hostile forces, and for exceptional courage in defense of military personnel welfare, it is my honor to present Lieutenant Colonel Rachel Kensington with the Silver Star for Valor." Rachel stood at attention as the medal was pinned to her uniform. Cameras flashed, the audience applauded, but she felt strangely disconnected from the moment, as if watching it happen to someone else. After the ceremony, she found herself in a quiet corridor with General Aldridge. He'd recovered remarkably well, doctors projecting a full return to active duty within months. "How does it feel?" he asked. "To be vindicated? To have your reputation restored?" Rachel touched the medal on her chest. Hollow. "The people who died because of those defective supplies, they're still gone. The soldiers I couldn't save in Kandahar, they're still dead. A medal doesn't change that." "No. But what you did after does." Aldridge pulled an envelope from his jacket. "I have an offer for you. The Pentagon is creating a new Special Operations Medical Task Force, integrated military-civilian trauma response, combat medical ethics oversight, supply chain integrity monitoring. They want you to lead it." Rachel took the envelope but didn't open it. "A task force, more committees, more bureaucracy, more power to prevent what happened from happening again." Aldridge corrected. "You'd have direct authority over medical procurement, the ability to audit contracts in real time, and a mandate to train the next generation of combat surgeons. It's everything you fought for, Rachel. The chance to actually fix the system. What if I don't want to fix it? What if I just want to practice medicine?" Aldridge studied her carefully. "Is that really what you want? To go back to routine surgeries and patient rounds? After everything you've seen, everything you've done, can you honestly tell me you'd be satisfied with that?" Rachel looked through the corridor windows at the Pentagon courtyard below. Service members moved purposefully between buildings, each one trusting that the equipment they used, the supplies they received, the medical care available to them was safe and effective. Most would never know how close that trust had come to being completely betrayed. "I need time to think," she said. "You have 24 hours, Aldridge replied. "After that, the position goes to someone else. And between you and me, there's no one else who has the credibility, the experience, and the pure, stubborn determination to make this work." That evening, Rachel returned to Walter Reed. She'd been offered quarters at the Pentagon, but she felt more at home in the hospital. Dr. Park found her in the ICU, checking on Corporal Mitchell, who was scheduled for discharge the next day. "You're back in uniform," Park observed. "Temporarily, maybe." Rachel reviewed Mitchell's chart. "He's healing well. No signs of residual pulmonary damage. He'll need follow-up, but his prognosis is excellent. You saved his life, all of their lives." Park paused. "I heard about the task force offer. Are you taking it?" "I don't know. Part of me wants to say yes, to build something that prevents others from going through what I did, but another part just wants to be a surgeon again, without the politics and the investigations and the constant fighting." "You'll never be just a surgeon," Park said gently. "Not after what you've exposed. People look to you now. Military physicians, whistleblowers, anyone who's ever been silenced for doing the right thing. You've become a symbol. I never wanted to be a symbol. No one ever does. But sometimes that's what's needed." Rachel visited each of the 4 soldiers before leaving the hospital. Torres was preparing to return to active duty, cleared by medical review. Whitmore was transitioning to a stateside assignment, his family grateful for his survival. Cordero was being promoted. his role in exposing the corruption recognized with a commendation. Mitchell was the last. He sat on his bed, dressed in civilian clothes, ready to go home to his family. "Dr. Kensington," he said, standing when she entered. "I wanted to thank you again. For everything. Just doing my job, Corporal." "No. You risked everything. Your career, your freedom, your life, to save us. That's not just a job. That's a calling." He pulled out a photograph from his wallet. "This is my daughter. She's 3. Because of you, I get to watch her grow up. I get to be her dad." Rachel felt emotion tighten her throat. She thought about the 17 children in Kandahar, about the countless lives she'd fought to save throughout her career. This was why she'd become a surgeon. Not for medals or recognition, but for moments like this. A father going home to his daughter. "Take care of yourself, Mitchell," she said. "And take care of her." After he left, Rachel walked the hospital corridors one final time. She passed residents studying, nurses managing patient care, surgeons discussing cases. Walter Reed hummed with life and purpose, exactly as a hospital should. In the emergency room, an ambulance arrived with a trauma patient. The team mobilized immediately, controlled chaos, practiced efficiency, every person knowing their role. Rachel watched from the sidelines, feeling the familiar pull of emergency medicine, the adrenaline of critical decision-making. Dr. Park appeared beside her. "You miss it, don't you? Being in the center of the action. Every day," Rachel admitted. "So take the task force position, build the program, but make sure it includes hands-on clinical work. You don't have to choose between leadership and surgery. You can do both." Rachel looked at her friend, at the hospital around them, at the life she'd fought so hard to reclaim. Park was right. She didn't have to choose. She could build the system she wanted while still practicing the medicine she loved. She pulled out her phone and sent a text to General Aldridge. "I accept. But I have conditions." His reply came within seconds. "I expected nothing less. Let's discuss tomorrow." Rachel smiled. For the first time in 18 months, maybe longer, she felt genuinely hopeful about the future. Not because she'd been vindicated or decorated, but because she had the chance to make real, lasting change. The fight wasn't over. It would probably never be over. But now she had the authority, the platform, and the support to fight it on her terms. And that was worth everything she'd sacrificed. 6 months later, Rachel stood in the new Special Operations Medical Task Force headquarters, a state-of-the-art facility adjacent to Walter Reed. The space was still being finished. Construction crews installing equipment, contractors running network cables, painters adding final touches. But it was real. It was happening. Dr. Park entered carrying coffee and a thick folder. She'd accepted Rachel's offer to serve as deputy director without hesitation. The first cohort of physicians arrives next week. 43 military surgeons from across all branches, plus 12 civilian trauma specialists. Everyone wants to be part of this. Rachel reviewed the roster. Names she recognized from deployment rosters, surgeons who'd faced the same problems she had, physicians who'd remained silent out of fear or uncertainty. Now they had a voice, a platform, and the authority to make changes. "What's our first priority?" Park asked. "Contract review. Every medical supply agreement currently in place gets audited. If it doesn't meet standards, it gets terminated." Rachel pulled up procurement data on her screen. "We've already identified 17 contracts with red flags. Medicorps was just the beginning. There are others." General Aldridge arrived for their scheduled briefing. He moved easily now, fully recovered, his command presence restored. "Colonel Kensington, the Secretary of Defense wants a status update for the Armed Services Committee hearing next month. They're scrutinizing every dollar we're spending." "Good. They should be." Rachel opened her presentation. "In 6 months, we've terminated 22 fraudulent contracts worth $300 million. We've implemented real-time auditing systems for medical supplies. We've trained over 200 physicians in combat ethics and supply chain integrity. And we've established a protected reporting system for whistleblowers." "No retaliation?" Aldridge asked. "Zero tolerance policy. Anyone who reports problems is protected by federal law and military regulation. We've already received 87 reports, and we're investigating every single one." Rachel paused. "The culture is changing, General. Physicians aren't afraid to speak up anymore." Aldridge nodded, satisfied. What about clinical operations? That's the exciting part. Rachel switched slides. We've integrated our training facility with Walter Reed's trauma unit. Every task force physician spends half their time in clinical practice, half in oversight and training. We're not just administrators. We're actively practicing medicine. Park added, we've also established partnerships with 5 major civilian trauma centers. Our protocols are being adopted nationwide. What Rachel developed in combat zones is now saving lives everywhere. The presentation continued for another hour. When Aldridge left, he looked genuinely impressed. You've built something remarkable here, Rachel. The Pentagon is already calling it the model for military medical reform. After he departed, Rachel walked through the training facility. In the simulation lab, young surgeons practiced emergency procedures under controlled chaos. Limited light, malfunctioning equipment, multiple casualties. The scenarios Rachel had lived through were now teaching tools. In the conference room, a group of military physicians discussed a supply chain problem they'd identified in their units. They debated solutions, reviewed data, and documented everything for formal reporting. No one was afraid. No one was silenced. Rachel's phone buzzed. A text from Corporal Mitchell. My daughter just turned 4. Wanted you to see. A photo showed a little girl with pigtails blowing out birthday candles, her father beside her smiling. Rachel saved the photo. These were the moments that mattered. The lives that continued. The futures that were possible because someone had fought for them. Dr. Park found her in her office later that afternoon. You have a visitor. Says it's personal. A woman in her 30s entered, wearing civilian clothes but moving with military bearing. She extended her hand. Colonel Kensington, I'm Captain Jennifer Walsh. I was deployed to Kandahar during the chemical attack. I was 10 years old. Rachel's breath caught. She studied the woman's face, and recognition dawned. You were one of the children. In the hospital. You saved my life. Walsh's voice was steady but emotional. I had severe sarin exposure. The medical team said I wouldn't survive. You operated on me for 6 hours straight. You refused to give up. She pulled out an envelope. I joined the Army Medical Corps because of you. I just graduated from surgical residency. I wanted you to be the first to know that I'm applying to your task force. I want to carry on what you started. Rachel felt tears prick her eyes. Of the 17 children she'd saved in Kandahar, she'd often wondered what became of them. Now one stood before her, a physician, a soldier, living proof that the fight had been worth it. You're hired, Rachel said. We need people who understand what we're fighting for. That evening, Rachel stood in Walter Reed's emergency room, scrubbed in beside Dr. Park for a trauma case. A construction worker had fallen 3 stories, multiple injuries, unstable vitals, the kind of case that required split-second decisions and absolute precision. Rachel worked with the confidence born of thousands of hours in operating rooms, in combat zones, in impossible situations where excellence was the only option. Her hands were steady. Her judgment was sharp. This was where she belonged, in the center of the action, fighting for lives that hung in the balance. The surgery lasted 4 hours. The patient survived. As Rachel stripped off her surgical gown, she felt the familiar satisfaction of work well done. Park stood beside her, equally exhausted and equally satisfied. You know what I realized? Park said. You never stopped being the ghost of Kandahar. You just changed battlefields. Rachel smiled. The mission's the same. Save lives. Fight corruption. Never give up. They walked through the hospital corridors together, past residents learning, nurses caring for patients, surgeons discussing cases. Walter Reed represented everything Rachel had fought to protect. A place where medicine was practiced with integrity, where truth mattered, where lives were valued above profit. In her office, Rachel found a package waiting. Inside was a framed photograph. The 17 children from Kandahar, now adults, gathered together. Beneath it, a note. We all survived because you refused to give up on us. Now we're living lives you made possible. Thank you for fighting for us. Rachel hung the photograph on her wall, directly across from her desk. Every day it would remind her why she'd made the choices she had, why she'd risked everything, why she continued fighting. Her phone buzzed with an incoming case. Mass casualty incident. Multiple trauma patients en route to Walter Reed. Rachel grabbed her coat and headed for the trauma bay, Dr. Park falling into step beside her. Ready? Park asked. Rachel thought about everything she'd survived, the battles, the betrayals, the fight for truth. She thought about the lives she'd saved, and the system she was rebuilding. She thought about the future she was creating, not just for herself, but for every physician who would come after. Always, she said. They moved through the hospital with purpose and confidence, two surgeons walking into the organized chaos of emergency medicine. Behind them, the Special Operations Medical Task Force stood as a monument to courage, integrity, and the refusal to accept that corruption was inevitable. Rachel Kensington had been called many things: the ghost of Kandahar, a whistleblower, a traitor, a hero. But the label that mattered most was the simplest: surgeon. A physician who'd taken an oath to first do no harm, who'd fought to uphold that oath against impossible odds, who'd built something lasting from the ashes of her destroyed career. The trauma bay doors opened. Patients streamed in. Rachel stepped forward, her hands ready, her mind clear, her purpose absolute. This was her battlefield. This was her calling. This was where she belonged. And nothing, no corruption, no politics, no threat, would ever stop her from fighting for the lives entrusted to her care. The work continued. The mission endured. And Rachel Kensington, once broken by a system she'd tried to fix, now stood at the heart of that system's transformation, not as a victim, but as its architect. The ghost of Kandahar had found her home, and she was never letting go.